Impact of Offender Health on Society by Chara Bowie, Houston Baptist University. Counselors and health professionals can be change agents of social injustice regarding mental and physical health. This research focuses on the connection between minority offenders, undiagnosed or late diagnosis of mental illness, chronic health, and the impact on our society. Individuals, particularly those within underserved communities with undiagnosed or untreated mental health conditions, have a dire consequence of continuing to feed the school to prison pipeline. These individuals often drop out of school, and their families tend to lack knowledge about mental illness and healthcare access. Unfortunately, some end up in the criminal justice system. This perpetrating cycle has a devastating impact on the social determinants of health within our underserved communities. Counselors that are culturally equipped have a small window of opportunity to help some of these individuals. This topic is significant because the United States locks up more people per capita than any other nation. In addition, the highest number of those incarcerated are minorities and from underserved communities. Therefore, this project is relevant to anyone interacting with minority youth, underserved communities, the justice system, elected officials, policymakers, mental and physical health organizations, and clients, criminal justice leaders, and staff. The purpose of this study is to answer one question. Or I should say, the purpose of this research is to answer one question. What are the health disparities within the prison system, and how do they affect our society? The methods The goal of this research was to review 5 scholarly journal studies that would assist with answering the research question, which was, what are the health disparities within the prison system and how do they affect our society? We used 2 databases to obtain these 5 scholarly journal studies. We use ProQuest.com, and then we also use BMC Public Health, their direct website. We also used for our methods particular inclusion criteria to locate the relevant articles. So we used specific terms to search. We used incarceration, we used mental health, we used physical health, we used health outcomes, health disparities, public health, community, also community health, also mass incarceration. So those were our key relevant terms that we searched for in different combinations. Next, we will talk about our results. So we stated previously that we reviewed 5 scholarly journals. And so the first one that we reviewed was a study called Inside the Nation's Largest Mental Health Institution, a prevalent study in a state prison system. And so the United States has the highest incarceration rate in the world, which we discussed, creating a public health crisis. As a result, correctional facilities have become a front line for mental health care, according to Dole, with this particular study that was done in 2017. So, the results of this study showed that obesity was prevalent in 38% of the inmates studied, and 51% had a history of smoking. Almost half of the inmates were diagnosed with mental illnesses, about 48%, of whom 29% had a severe mental illness. 41% of females and 20% of males, to be exact. And 20% had a history of substance abuse use disorder. Finally, females had higher odds of having both a mental illness and a substance abuse um, use disorder. Almost all mental illness diagnoses were first made during their incarceration at a staggering 99%. This study concludes that a large part of understanding the mental health problem in our country starts with understanding the mental health problems um, in the prisons. The next study that we reviewed was a study by Hamilton in 2015 that was named The Collateral Damage of Mass Incarceration, Risk of Psychiatric Morbidity Among Non-Incarcerated Residents of High Incarceration Neighborhoods. And so we know that incarceration exerts collateral damage on the mental health of individuals living in high incarcerated neighborhoods. The study suggests that the public mental health impact of mass incarceration extends well beyond those who are incarcerated. This study found that controlling for individual and neighborhood level risk factors, individuals living in neighborhoods with high prison admission rates were more likely to meet criteria for a major depressive disorder and a lifetime generalized anxiety disorder than were individuals living in neighborhoods with low prison admission rates. Our next study was a 2022 study regarding prenatal health care after sentencing reform, effects for prenatal health care access and equity. So, high imprisonment rates in the United States have significant health and social and economic consequences, particularly for marginalized communities. Imprisonment's used as a contextual driver of receiving prenatal care. So, in this study, Pennsylvania's sentencing reforms was associated with small advancements in racial and social economic equity. And so, the Pennsylvania as a state went through sentencing reform. And they found that in counties where prison admissions declined the most after the policy was enacted, early prenatal care increased from 69% to 73.2%, and inadequate prenatal care decreased from 18.1% to 15.9%. They found this pattern of improvement to be particularly strong among Black birthing people and those with lower level education attainment rates. So our next study was a study from 2020 entitled The Relationship Between Community Public Health, Behavioral Health Services, Accessibility, and Mass Incarceration. The relationship between behavioral health services, demographics, and community factors and incarceration rates has not been well addressed according to this study. They found that counties with small populations, larger percentages of individuals that did not graduate from high school, have more health-related issues and provide fewer community treatment services, are more likely to have a high jail population per capita. Increasing access to services, including mental health providers, and improving drug treatment and healthcare affordability may help reduce incarceration. And our final study that we reviewed was a study called a prospective cohort study examining exposure to incarceration and cardiovascular disease. And so this was a study from 2020. People incarcerated have high rates of cardiovascular risk factors such as hypertension and smoking, and cardiovascular disease is a leading cause of hospitalizations and mortality in this particular population. The results of this study is not yet complete because the clients are followed for 1 year after release, so we haven't gotten to that 1 year mark. But the study hopes to identify factors associated with cardiovascular disease risk factors controlling among people released from incarceration. There are measures of incarceration related Exposure, psychosocial factors, and clinical measures of cardiovascular risk will allow for identification of unique targets for intervention to modify cardiovascular disease risk in this vulnerable population. So we will be very excited to see and read about the results of that study. So for our discussion, we know that the school to prison pipeline devastates our underserved communities, families, and individuals. Our healthcare system lacks access and proves inadequate in slowing this cycle of poor health outcomes for youth and incarcerated individuals, and especially those re entering into those same underserved communities. Studies show that the prison reform has an impact on giving babies and mothers a healthier start with prenatal care. Studies show that a high percentage of offenders have undiagnosed mental health disorders. Studies also show that inmates have a higher rate of chronic disease. Studies show that the collateral damage of the high incarceration neighborhoods that bear the brunt of these poor health outcomes. So, as counselors and health professionals, we must go above and beyond and operate as change agents in these underserved communities within the small window of opportunity that we do have. Because these studies show the impact of offender health on society, it is imperative to create programs and initiatives, to improve health outcomes in underserved communities and prison reentry programs. So the answer to my question is yes. The limitations of my study was the small sample size. To be able to answer my questions more thoroughly, more research studies must be reviewed. There is, of course, need for further research, especially longitudinal studies that compare health statistics for communities, incarcerated individuals, and those re entering our society.